Good evening, tribe. I'm so excited to be here tonight with Kimberly. She's going to share her story with us, and I'm just so thankful that she gave us the opportunity to chat with her. So welcome, Kimberly.
Thank you. Hi.
You want to go by Kimberly or Kim?
Either one.
Okay. So tell us a little bit about yourself.
So my name is Kimberly. I'm 25 years old. I'm a pediatric nurse at Riverside University Health System. I've been doing it for 2 years now. I also recently bought a home, and I'm a proud dog mom.
Yay! And her dog is super cute. All right, viewers, as you guys tune in, feel free to enter questions. I will ask them as they flow throughout our conversation. Just send them in the comments and we'll get to those. So you spent quite a bit of time in and out of the hospital as a child, is that right?
Mm-hmm. Yeah.
Do you remember any of your nurses, like by name specifically?
No, I don't, but I do remember everything they did for me. But I was so drugged up or not feeling good, I couldn't remember much.
Sure. So do you remember specific characteristics that you've taken with you in your nursing practice from your childhood?
Well, I do remember one nurse in middle school. She talked to me in the middle of the night. I wasn't feeling good. And my mom was there and she was trying to comfort me. And I wasn't in pain and I wasn't really hurting or anything like that. But I was just uncomfortable and I couldn't sleep. I kept tossing and turning in the bed. And so my mom just called the nurse for some ice water. And I remember she came in and she just came and sat next to me and she just started talking to me. And she just ended up praying for me. And I remember she kind of just was wiping my head down and she sang to me. I mean, she stayed in there, I think, probably for about a half hour. And that was the one person that really touched me, that made me want to become a nurse. So that was something that I wanted to take with me. And especially with me working night shift, it's about like taking that time, even when you feel like you don't have any time, and making that patient feel like they're the one person, you know, in the whole hospital. So that was really neat for me.
And you think back on those 30 minutes that nurse spent with you and just how profound that is in our schedule. Like, she spent so long, you know, that's just amazing. I love that. So when did you decide that you wanted to be a nurse and why?
Oh, it was in middle school. And again, it was from that experience with that nurse, but I really had been in and out of the hospital so many times. I've had 13 surgeries on my hands and feet. So I had a lot of experience with hospitals, and oddly enough, I actually liked being in the hospital. I started volunteering. I just wanted to give back any way I could. And even at that young of an age, that was kind of my goal was, you know, I've been through this. I know what it feels like. And I knew at that point I wanted to be a pediatric nurse, and I thought I could make a difference with these kids since I was a kid and I was in the hospital.
So you were told at one point that you needed to choose another major. How would you encourage others who face that discouragement and negativity, and how do you deal with that?
Well, when I was told that I had to change my major, I was disappointed. It was kind of a hard time. I kept applying to the nursing program over and over again. But lots of other students, they got the same letters that I did. In California, I don't know if you know, but we're super impacted in all our nursing programs. So a lot of people don't get in, and but I just kept applying. And I think that's the thing that you have to do, is you just have to keep trying. And if you have a goal in mind, you just need to go for it. And, you know, like I'm a believer, I believe in Jesus, and I believe he opened those right doors for me. So, yeah.
That's amazing. I love that. A viewer said, hi, Kim, but I can't see their name for some reason. So someone's saying hi to you.
Oh.
Let's see. So you were told that you were not going to make it through the nursing program. How did you handle that? And would you change anything about the way you handled it?
Well, I was told when I went into the admissions office for the nursing program, as soon as I walked in, I was told that you would not make it in this nursing program. And I don't really know what that entails. You know, I don't know if they were looking at my hands or if they just were just saying that because of how impacted their program was.
Sure.
But I wouldn't really change anything. I think a lot of my life has been waiting. I've had summers where I've spent 3 months in bed on my back because I couldn't get up because I'm in 2 casts or something like that.
Yeah.
And it just taught me a lot about being patient and perseverant and going for the things I wanted in life. And so I think it built my character and it made me the person I am today. And it made me fight even harder. And it makes me fight for my patients in my job, you know, making sure that they have what they need. And I'm a good patient's advocate, I think, because of that. And so I appreciate the experiences I've had, even though they've been hard.
Amen to that. That's awesome. Brianna says, amen, you inspire me, Kim. So talk a little bit about your developmental, you talked about your hands needing surgery and your feet. So do you want to talk a little bit about that? I know it's so rare. I had to look it up because I had no idea what it was. But yeah, do you want to talk a little bit about that?
Sure. So it's called Tsunami Linn syndrome. It happens in the womb. It's from a recessive gene. It typically comes from the German line, and it's now moving over into like Saudi Arabia areas, but I think it's because of like people, you know, intermingling and such. So there's only 30 people in the world known that have this type of disorder. So it's super rare. It affects from the forearm down and then from the knee down. So on my left side, I have one bone that's fused together and then the other one has the 2. And then when I was born, my hands were all webbed and I only have 4 fingers on each hand. And then my feet, I have 4 on the right and then I have 5 on the left. So most of it was just trying to create a pinch. Like I couldn't even pinch objects until I was about 3 years old. They created so that I could grasp things. And so that I still remember picking up a piece of paper and running through my house and screaming and laughing because I could finally grasp something in my fingers. So yeah, but that's basically the only way that it can be corrected is through surgery. So a lot of the cases out in Germany, they're a lot worse than mine because my doctor, he studied over there. And that was a blessing in itself because he's one of the few people that knows about my case. And I was lucky that I lived where I live. And he's from Loma Linda University. So he was able to perform my surgeries and just a great, awesome doctor. So
yeah, that's phenomenal. So when you experience the adversity and being told you're not going to make it through nursing school, I've had multiple people contact me personally, privately, and also live in the tribe. People have really been expressing, you know, professors not believing in them, or one particular member contacted me and said, I have a disability and I don't know if I can do this. And so, and also that bullying aspect, there's a post right now in the tribe that said after 3 days of orientation, this person was told they're not going to make it. How would you encourage those people who are in nursing school or in the field already? How do you encourage them to pursue?
Well, I would just say working hard and practicing. I mean, I know for me, one of the things that I struggled with, like emotionally in the nursing program was, am I not good enough? Am I like, if somebody else is struggling popping open this, you know, vial, or if they're struggling opening up an IV bag, they're like, oh, they're just struggling. That's normal. Like everybody struggles. But if I struggled, I felt like they would look at me and be like, well, it's because of your hands. That's why you're not able to do this. And the school I went to, RCC, they were so supportive of me. But, you know, we're human, and I'm sure people had doubts. And I just always had that in the back of my mind was, you know, like I have to be better than everybody else. And so I think because of that thought process, it just pushed me to work harder, to practice more. I mean, one of the things I would say, especially to the nursing students out there, is to get in a good group that can support you. Because I know when I went through nursing school and I was looking at some of the people that, maybe failed a semester or, weren't flourishing, it's because they weren't rooted in a good group, and I understand there's people that like to study by themselves, but at least, take an hour out of your week, go hang out, try and get together in a group. And I know that's what really helped me, was finding that encouraging group. And then even at my work now, the group that I work with, they're so supportive and so loving. And I volunteered for a long time on the unit that I work at now.
Oh, that's amazing.
So I really got to see, hey, these are the kind of people I want to work with. They supported me. They would talk to me about my prerequisites, my school. So I think it's important if you can get out there and volunteer, make those connections with people. And they look at you. They look at you even when you're just volunteering. And I remember them saying, we like you because of your hard work and your ethics back then. So get connected to people. I think that's important.
Absolutely. And voice, if you're needing extra help, find that person that can help you, whether it's a tutor or a professor or whatever that looks like, right? I think, what was the next question? Oh, so talking about challenges, we all have an area in nursing school that proves to be even more challenging than others. Mine was identifying and labeling the nerves and muscles in the cadaver lab. What was yours?
Well, for me, academically, I would say the kidneys. I don't know why they bothered me so much, but they really did. All those little sodium, the potassium, and I'm one of those people that I'm a big picture person, so I don't like those little details. And I remember if I can't see it, I'm like, I don't even think it's real, which is really silly thinking. But I know that's something that I struggled with academically. But luckily, my friend in nursing school, she loves the kidneys, and her family had kidney disease and stuff. So she was always helping me. And then I was really good with the heart. I love the heart, and you could hold it in anatomy class. It was so cool. So I remember helping my friend with that because she struggled with that. So it was perfect. Like I said, you got to make those connections.
I totally agree. My study group is the only way I was able to get through nursing school. I literally felt like if I could teach you, then I really knew what I was talking about. Yeah. And that's exactly how I survived. And there was a group of 6 of us. Make sure your group's not too big, then it gets too chatty and unproductive. But yeah, if you guys can keep giving each other things that you're struggling with and they can teach you and vice versa, it's so helpful. We have a few comments coming in, not questions, but I'll go ahead and read them anyway. Marie said, wow, what a blessing that doctor was your doctor. Brianna said, so true. Surround yourself with the ones that make you feel supported. Us nurses need each other. Layla said, wow. Brianna said, RAS system, nightmares. And then RAAS. Yeah. So, yes, all of those are wonderful. If you guys have any questions, please get them in. Let's see. So you were declined. Oh, and we already talked about that. Sorry, I'm looking through my question list. You already told us that you work in pediatrics. Did you do anything other than pediatrics prior to coming in? You said you volunteered. Did you do any other type of nursing?
I worked as a CNA for a year prior to nursing. So I got to look at all the different floors. I went to ER, ICU, PCU, but I booked myself, so I was mostly in pediatrics, but I got to experience all those different units, and that really helped me, I think, with organization for nursing, especially because I worked as a CNA at the hospital that I work at as an RN. So the charting was easy to pick up. And like I said, organizational skills, you have to be so organized as a CNA when you got 16 patients that all need bed baths and vitals and all this stuff. So that was really helpful. And then also, like I said, I volunteered on that unit. I volunteered as a kid. I was always in the hospital. So really prepared me for for this career. It was meant to be.
That's so great. I agree. I was also a CNA. It was the best decision I made. And I also floated it across the whole hospital. You really get a nice taste of, do I want a little bit more of this, or I think I'm good.
Yeah.
Hi, Suzanne. Thanks for being here. I say hi. I see you. Let's see. So what is the process of training like in your institution, particularly as a pediatric nurse?
Well, for pediatrics, you can be hired right in as a new grad. The program is about 6 to 8 weeks, depending on, if they feel like you need a little more or you want a little bit more. You work with a preceptor, and they try to assign you one that fits with your personality. And my preceptor, I loved her. Me and her were on the same page. Like I always told her, I was like, we should do team nursing and get paid the same, but that doesn't work. So, but we had a good time, and I learned a lot, learned quick. And then, they may have like a couple other preceptors, but for the most part, they try to stick you with just the one so that, you can keep progressing and they can keep helping you. So that's how it basically goes for the training.
How do you guys accommodate someone that needs more help with IVs or Foleys, or maybe a concept that they're not grasping? How does your floor help foster those nurses?
I would just say practicing together, especially in pediatrics. I don't know how it all works on the adult floor, but it's a super team dynamic because you have a little tiny baby, and that baby is screaming, crying, kicking, biting, whatever. So it takes about, honestly, 3 of us to put an IV in. It takes 2 of us to put any kind of, straight cath in, Foley. We're very focused on team nursing, I guess. So that was really helpful to me because, we'll be right next to you and we'll be like, hey, that's a good vein right there. Go for that. So it's very, very team dynamics on the unit that I'm on. So I think that was also super beneficial for me because if I ever had an issue, someone was right there with me. So we really worked together.
Yeah, it's great. Hi, Tanya. I see you. Let's see. So as an industry, do you feel like we do a good job accommodating those who struggle in various areas? Your unit sounds like a wonderful team environment, and maybe viewers, you guys can chime in. Do you feel like as an industry, we do a good job accommodating those who need a little extra help, whatever that may be?
I think with nursing, the people that are going there, they're there to care for people. They want to see people succeed. There's always going to be bad people in the world. That's just the world. Yeah. So I wouldn't really say, I would say our profession does do a pretty good job trying to foster people and care for people. I know one of the ways that I really did well in nursing school was I had a mentor that I'd known from the hospital. She was the CNO of the hospital that actually my mom worked at as a secretary. So I got to know her through that. And she took the time to have me start IVs on her before nursing school. Bless her heart.
Right.
And I was able to get them. I was able to practice that technique. I practiced sterile gloving. I did all these things. So I really feel like nurses have a heart to want to take care of, these new nurses, and they want to foster new growth. So yeah,
that's a great idea. And you know what? Maybe in the tribe, we can start fostering that environment for nurses that need a mentor. If you're in that area and you're willing to mentor, reach out to some students. Tell them you're willing to be a pincushion for them, or to talk about sterile technique, or whatever it is that they're struggling with. We all get so daunted by, okay, you're going to practice sterile technique today and be checked off. And when you're in nursing school, that just seems so daunting. Like, what if I make a mistake? Then you say, I made a mistake. Can I start over? Like, as long as you realize that you've made a mistake, that's where you can start changing things. So yeah, absolutely. I love that you had a mentor. I'd never thought about that. That's great. So, How would you encourage someone to speak up for themselves if they're needing extra training or time or support with certain tasks or concepts? Like, was there anything IV starts, or you said you had someone that you was allowed you to do that on them, but anything that you personally had to really get extra time and instruction on, and how would you encourage others to do the same?
Well, I would just say, again, being open with your instructors. I know that if they saw me struggling with something, they would just pull me aside and be like, hey, this is what I'm concerned about. Is there any way that we can fix this? And especially for me, because, it's not that I couldn't do the skills of nursing. It's just I had to figure out, how can I be sterile? How can I be clean, and do it the way that works for me?
Right.
So, and that was definitely, I think with some instructors, it was more of a challenge for them to kind of figure that out, which again, we're human, like I totally get it. And, some of them were just so on point. They had all these ideas, but I think a lot of it too is just trying things, trying different ways. And I know for me, I would talk to my my classmates, and I would just tell them like, hey, what do you think if I did this, this, and this? Do you think that would be, clean or sterile or okay? And, we would just try it out in the lab. So, I mean, just practicing and like I said, just use those resources that are available to you. Talk to those people, find someone too that, someone that could be a confidant for you, someone that you can trust. You don't want to go and talk to just anyone. You want to make sure it's someone that, truly cares about you and wants to see you succeed.
Absolutely. And when I was a new nurse, I would go around to every nurse I was on shift with and be like, hey, if you have any sterile procedures, can you please come get me? I would love to come watch. And sometimes they'd let me do it and sometimes they wouldn't, which is fine. But watching over and over, you get new ideas. I learned a new way to do, a sterile Foley. They were taping their open packages to the side of the table. And I was like, why have I never thought of this before? It was genius. And so anyways, it was just picking up on so many different techniques. There is so many different ways to do pretty much everything that we do. So take advantage of your senior nurses and get exposure, get in there. All right. What other encouragement do you have for the tribe?
I would just say, if you have goals in mind, if you have dreams or aspirations, to go for them, just fight for them, work hard, don't stop, don't let people discourage you, because you know what you can do, what challenges that you can face, what you can handle. So I would just say, go for it, guys, and find those people that you can count on.
Absolutely. If there's no questions for the tribe, or even if you guys have questions afterwards, I'm sure Kimberly will be happy to answer them once she sees the feed come through live in the tribe. Thank you so much for giving us your time, Kimberly. It was so great.
Yeah, thank you, Chelsea.
Thank you. Super encouraging. Have a great night, tribe.
All right.